Hey, hi, ma'am.
Hi,
So,
Priyanka.
as a World Kidney Cancer Day, we are doing an awareness. So, nimge gottira age, so you are a specialist in that. So, just want to ask some questions. You can just tell the audience about what it happens, ಹೇಗಾಗುತ್ತೆ ಹೆಂಗೆ ತಡೆ ಮಾಡಿಸ್ಬೋದು ಅಂತ. So, first question, what is kidney cancer and what are the types of kidney cancer?
ಸೊ ಕಿಡ್ನಿ ಕ್ಯಾನ್ಸರ್ ಅಂದ್ರೆ ಈ ಕ್ಯಾನ್ಸರ್ ಶುರು ಆಗೋದು ಕ್ಯಾನ್ಸರ್ ಸೆಲ್ಸ್ ಶುರು ಆಗೋದು ಕಿಡ್ನಿ ಟಿಶ್ಯೂ ಇಂದ. ಸೊ ಆಸ್ ವಿ ನೋ, ಕಿಡ್ನೀಸ್ ಹ್ಯಾವ್ ತ್ರೀ ಟೈಪ್ಸ್ ಆಫ್ tissues. One is the part or the cells which take care of filtering of the blood into urine, and the other one is the collecting ducts, and also where the urine is stored. And the other third one is where there are embryonic cells they are originating from. So depending on this, where the cancer is arising from, so it can be divided into three types. One is most common is the renal cell carcinoma, which arises from the cells which filters or are involved in the filtering of the blood into urine. So renal cell carcinoma, this is very most common. The other one is called transitional cell carcinoma, which arises from the tissues or cells which are involved in storing of the urine. And the third is seen, it's called Wilms tumor or nephroblastoma, which is seen in very young children and is one of the curable cancers. It's called Wilms tumor. So these are the three types of cancers, and basically it arises from the kidney cancer, kidney cells.
Okay. The second question is, what is the early signs of kidney cancer? How do you find out that?
Yeah. So unfortunately, like many cancers from the abdomen and the deeper abdomen, kidney cancer is not diagnosed with symptoms, and when it is diagnosed with symptoms, it is usually advanced. But then it can present as a mass in the abdomen, as a lump or mass, which is detected by a master health check or any other scan which is done for some other reason. Or it can present with blood in the urine, and which is investigated, and then we find out a kidney cancer. It can also present as low backache or pelvic pain, and in advanced stages, when it has reached other organs, can present with bone pains, or if it has gone to the lungs, it can present with cough or breathlessness. So these are the different manifestations.
Okay. How can you properly diagnose the kidney cancer?
Yeah. So to diagnose kidney cancer, once you have a suspicion, there are methods. The best modality for any cancer, as we know, is a biopsy or a tissue which says it has cancer. So many of the times, if we see a mass in the kidney, we take it as usually as a tumor, and then we address it with surgery, which acts as a diagnostic as well as a therapeutic modality. And other imaging techniques like CT scans and MRI abdomen or CT scan with contrast can diagnose kidney cancer. And some of the urine tests like urine cytology can also sometimes pick up these cancer cells. So these are the different modalities of diagnosis.
Okay. So what are the treatments? How can be treated for kidney cancer?
So a curative, to cure a kidney cancer, it should be confined to the kidney, and then that is when you can cure kidney cancer, and surgery is the modality of choice. Most of the times we try to save the full kidney by doing a partial nephrectomy, or sometimes if it is a big tumor, it will be a radical nephrectomy, and as you know, that is removal of one kidney. As you know, one kidney is enough for sustenance or survival. So that is the best or curative modality. And other modalities of treatment are seen in when it is advanced, when it is spread to other organs. There are methods like immunotherapy, targeted therapies, which we call tyrosine kinase inhibitors, tablets. Nowadays, with immunotherapy and these new tablets or drugs, even in the fourth stage, in incurable stage, we have tried to improve the outcomes and survival in these patients.
Okay, so how to reduce the risk of kidney cancer? This will be the last question.
Yeah. So there is no specific intervention, lifestyle intervention to reduce kidney cancer. But as a whole, all cancers nowadays are being recognized as lifestyle cancers, lifestyle related diseases. So having a good, healthy diet, more rich in vegetables and fruits and fiber, less of processed foods and less of processed meat, reduction in alcohol intake. Alcohol is one of the risk factors for bladder cancer, and smoking actually is a risk factor for bladder cancer and kidney cancers. So avoiding smoking and alcohol is a good lifestyle intervention. Maintaining an ideal body weight can be a good lifestyle change for any prevention of any cancer. And being aware of your changes in the body. If you see urine, a male, elderly male looks at urine in the, blood in the urine, should never ever ignore it. It has to be investigated. You may be missing a kidney cancer or a bladder cancer. So being aware of your changes in the body, I think, is a most important thing. Being aware of a subtle change which happens in your body can many times diagnose cancers in a curative stage.
Okay, so as many people audience are watching you, so what do you want to tell them? So how can you tell them to prevent all those things?
Yeah. So as I mentioned, so lifestyle modification. I think we are all into a sedentary age, and sitting is the new tobacco, as you say. So tobacco also is bad, and sitting is also bad. I think having a good, healthy, active lifestyle, which can be inculcated from a younger age, and also avoiding tobacco. And we think that tobacco, maybe I'll just be an occasional smoker or an occasional alcoholic. Even those are recognized now as risk factors for cancer. I think making these smaller changes in lifestyle can go a long way in preventing cancers, including kidney cancer. Yes.
I guess all the audience have got the answers from you. Anyways, ma'am, thank you so much.
Thank you for having me.
Thank you.